Hi, let's talk about ethical dilemma in nursing. This is a situation where a nurse must choose between two or more conflicting choices, none of which provides a completely satisfactory or morally sound answer. These conflicts arise from competing values such as patient autonomy versus the nurse's duty to do good, that's the beneficence, or when the legal and the professional obligations are in tension. Let's look at scenarios where you might encounter ethical dilemma. End of life care. During end of life care, the nurse might be in a dilemma when they have to balance conflicting wishes between the patient and that of the family. This occurs when the family members disagree with the patient's end of life decisions, such as do not resuscitate code starters or patient choosing to go on hospice. Informed consent. Informed consent is a process of communication and education between a healthcare provider and a patient that ensures the patient's voluntary agreement to a procedure or treatment. This process respects the patient's ethical and legal right to autonomy and self determination in making decisions about their own healthcare. For life changing or serious procedures, only providers, that is, a doctor, the nursing practitioner, physician assistants, are the ones who can obtain informed consent. Nurses, on the other hand, only confirm or witness consent that the patient received sufficient education, information before the procedure, and that the patient has the capacity to give consent. But for day-to-day activities such as medication administration, the nurse has to turn the patient and reposition. The patient has to get ACDs on to prevent DVT. Before performing any activity on a patient, the patient has to be informed what they're about to be given or exposed to and the benefits or any potential side effects. And after that, they have the right to refuse even if it puts their life at risk or even if it's against the nurse's belief on what's best for the patient. If the patient refuses to put on the ACDs or take heparin shot for DVT prophylaxis, you cannot force it on them. You will teach them the benefits and the risks of not doing so. And if they still refuse, then the next best thing is to escalate, but you do not force the patient. Confidentiality versus duty to one. This is where a nurse must navigate the conflict between keeping a patient's information private and the obligation to warn a third party if there is a foreseeable danger to them. Think about this scenario. A patient discloses to you that they just found out that they are HIV positive. At the same time, the patient states that they just started a new relationship with this new boyfriend. She tells you not to disclose to the boyfriend. The boyfriend is waiting outside and tells you if you tell the boyfriend is going to leave me, do not disclose this information. This is a dilemma because if the boyfriend is not told, he will be infected. But HIPAA or ethics of confidentiality states that you have to keep this information private unless the patient gives you permission to disclose. Nurses sometimes face ethical dilemmas in allocation of resources. Um, and this could be maybe during shortages, night shortages, or maybe you don't have enough of tube feedings. And so some patient will get the feeding and some may not. And this can really be, the nurse can be in dilemma because you want to advocate for all your patients, but at this point, your hands are tied. Cultural and religious beliefs. A nurse must respect a patient's cultural and religious belief, even if they clash with their medical advice, while still ensuring the patient receives appropriate care. So then, how do we solve these dilemma issues? It's the chain of command. Go up the chain of command. Report the situation to the nurse management, then to the charge, unit manager, director. If they cannot help solve it, then the dilemma is forwarded to the ethics committee. What do they do, the ethics committee, and what's their role in all this? In nursing ethics committee, the ethics committee is an interdisciplinary body that provides guidance on moral and ethical dilemmas in healthcare. They help in resolving conflicts and ensuring patient care aligns with their ethical principles. They are often composed of nurses, physicians, administrators, social workers, and clergy. Their role includes reviewing patient care situations, developing ethical policies, and educating staff on ethical issues. They do not give orders or decide what is going to happen going forward. Their role is to mediate by facilitating open discussions between patients, families, and healthcare providers to resolve the conflict. Thank you for watching. Please subscribe, share, and like to help me grow this channel. I'm putting so much of my effort to make sure that you guys get this content out in due time. Look out for more videos and see you on the next one. Bye.